Hi, my name is Paul Vessa. I'm a board-certified spine surgeon in New Jersey. I've been in practice 21 years, and I work for the Spine Surgery Associates. I think what makes the practice at Spine Surgery Associates so unique is the perspective that myself and my partner, Dr. Dwyer, bring to the practice. We have, over the last 20 plus years now, worked a certain way that we think benefits the patients tremendously. And by that I mean each of us is the primary on our patients, and the other doctor, the other surgeon, is always the assistant. Because of that, we have two board-certified spine surgeons on every case. Now, oftentimes that can be overkill on a simple lamb disc, but I've had a professor in spine surgery who liked to say that there is no such thing as simple spine surgery. But because the two of us are there and we've got two sets of eyes looking at the problem, oftentimes one will make one suggestion or the other will make another suggestion. And I think in the end the patients benefit tremendously from the cumulative experience of two spine surgeons over the last 20 plus years. But I think that what makes Spine Surgery Associates so truly unique is that there are two surgeons that are on every single case. That are working together with the sole purpose of trying to get the patient as better as quickly as possible with the least amount of tissue damage during the operative procedure. By virtue of having that cumulative level of experience, I think truly makes Spine Surgery Associates unique in the field of spine surgery. The complaints of back pain and neck pain are so common. Most people don't realize that the natural history of back pain and neck pain is very forgiving. And by that I mean that if you did absolutely nothing and just took rest for a day or two and took some anti-inflammatories, you would likely get considerably better. What I tell most of my patients, if I had 100 patients with back pain that came to me as a first visit, and I sent them for therapy and gave them some anti-inflammatories, that probably 95 of them would be improved. That leaves about 5 out of 100 that require a little bit more complexity with regards to the workup and treatment. But the natural history being so forgiving, anybody with acute back pain for a short period of time, certainly a few days to a week or so, should really just try the anti-inflammatories and exercises prescribed by any one of a number of physicians. However, if you're not better to your satisfaction in a short period of time, 4 to 6 weeks, and certainly if you're a businessman with a very tight schedule, it might be a little bit shorter than 4 to 6 weeks because you can't travel with back pain, then you need to see a specialist who can give you a very detailed examination, explain to you exactly what their concerns are with regards to your examination and your history, and then order a specific imaging study, usually an MRI scan, a plain set of x-rays, including a motion x-ray, so that you can get a sense about where the diagnosis may be and then what the treatment should be. We find that by treating everybody conservatively first and then only focusing our attentions on those people who failed conservative care, that our operative results are that much better. It's changed a lot, but it is technically a demanding field, but also a tremendously gratifying field, because oftentimes patients are in a lot of pain. They're not able to perform the normal household activities that they could before. They could not work, or perhaps they could not do a particular sport they wanted to do. And our job is to try to return them back to a lifestyle that is satisfactory to them. And it can be very, very rewarding, particularly the patients come in and they're very, very troubled by their pain. Sometimes it's written all over their faces, and oftentimes the nurses in my office will remark after we've seen them, diagnose them, and then fix them, that they're different people. They're smiling, they're standing upright, they're more polite. Not that most people aren't polite, but oftentimes we see people who have been in pain for weeks to months. They've never really been told what's wrong with them, and they're sort of down on the system, if you will, and we try to restore their confidence in the system and get them better as quickly as possible. But the field itself can be very gratifying, and I think that we do a pretty good job here.